All right, let's talk about one of the biggest hurdles for the pharmacy technician certification exam. You know the one I mean, the top 200 drugs list. Instead of just trying to memorize that massive thing from start to finish, which, let's be honest, is a nightmare, we're going to use a much smarter strategy. We've broken down all 200 drugs into 4 manageable tiers. And this isn't random. It's based on what's most important for the exam and what gets prescribed the most. This whole approach is about maximizing your study time. So today we're diving headfirst into Tier 1, the 50 absolute must-know drug.
So have you ever pulled up that top 200 list, taken one look, and just felt your brain kind of shut down? Yeah, you're definitely not alone. It's totally normal to feel overwhelmed by it. But here's the good news. You absolutely do not have to memorize it like a phone book. Phew, right? There's a much better way to do this.
And that's really the secret sauce here. We're going to study smarter, not harder. We're focusing our energy where it's going to count the most, and that starts with these Tier 1 drugs. Think of them as the highest yield, most important medications on the entire exam. They get prescribed all the time, and knowing them inside and out, I mean brand name, generic name, what class they're in, and what they're used for, is pretty much non-negotiable for passing. This is where we build our rock-solid foundation.
Okay, so here's our roadmap for today. We'll kick things off with a game plan to make sure this info actually sticks. Then, we'll jump into the big 3 groups: cardiovascular drugs, CNS drugs, and a few other key players you'll see everywhere. And we'll wrap up with what to do next to get certified. Sound good? Let's get started.
All right, Section 1, the game plan. Seriously, how you study is just as important as what you study. You can't just passively watch this and hope for the best. You need a system to really lock this information into your brain.
So to really make this stuff stick, I want you to use these 4 techniques. They're game changers. First, group these drugs by their class. Instead of memorizing 50 separate facts, you're learning just a handful of related groups. It's so much easier. Second, and this is a big one, focus on the suffixes. You know, the endings of the names like all or statin. They're like cheat codes that tell you what the drug does. Third, use active recall. That means quizzing yourself, not just rereading the list over and over. And finally, and I'm serious about this one, say the names out loud. Actually saying atorvastatin or lisinopril helps build that memory. Trust me on this.
All right, let's do it. Section 2, cardiovascular drugs. Kind of literally the heart of the matter, right? These are some of the most prescribed medications on the planet, which means they are absolutely critical for the PTCE. Let's dive in.
Okay, first up, we've got the statins. And right away, that suffix tip we just talked about comes into play. See it? Atorvastatin, rosuvastatin, simvastatin. You get the idea. If you see that statin ending, your brain should immediately go high cholesterol. These are the big ones you'll see all the time, like Lipitor and Crestor.
Moving on to some core blood pressure meds. We're looking at 3 totally different classes here, so pay attention. First is lisinopril, which is an ACE inhibitor. And here's another pro tip. Look at that pril at the end. That's your clue for pretty much the whole ACE inhibitor class. Then you've got losartan. That's an ARB. And amlodipine, which is a calcium channel blocker. These 3 are absolute cornerstones for treating high blood pressure. And next up, the beta blockers. And oh man, this is a perfect example of that suffix rule again. You see that old ending, metoprolol, carvedilol, that should just scream beta blocker to you. They're for blood pressure and a bunch of other heart conditions. Now here's a really important point for the exam, so listen up. Notice we have 2 kinds of metoprolol. Tartrate, which is low pressure, is immediate release, but succinate, which is Toprol XL, is extended release. That XL is your clue. It's a common trick question, so lock that one in.
Okay, let's talk diuretics, or as a lot of people call them, water pills. The name kind of says it all, right? They help your body get rid of extra salt and water, which in turn lowers blood pressure. In this top tier, we've got 3 main types. There's hydrochlorothiazide, yeah, it's a mouthful, that's a thiazide diuretic. Then you have furosemide, better known as Lasix, which is a really powerful loop diuretic. And then there's spironolactone, which is special. It's potassium sparing, meaning it helps your body hang on to potassium, which the other 2 don't. That's a key difference.
And to wrap up our heart section, let's look at the blood thinners. Now, that term is a bit of a misnomer. They don't actually thin the blood. They prevent dangerous clots from forming. And what's really cool is how they do it in completely different ways. You've got apixaban or Eliquis, which is a factor XA inhibitor. Then there's clopidogrel or Plavix, which literally stops platelets from getting sticky and clumping up. And finally, you have the old school classic warfarin, brand name Coumadin, which works by blocking vitamin K. So see, 3 totally different strategies, all for the same goal, no clots.
Okay, take a deep breath. We're switching gears now and moving on to our second major category, central nervous system drugs, or CNS drugs. This is a massive group, and it's super important. We're talking about medications for everything from depression and anxiety to pain and ADHD.
First up in the CNS category are the SSRIs. This is probably the most common class of antidepressants out there, and trust me, you are going to see these all the time. You've got to know sertraline, which is Zoloft, escitalopram, which is Lexapro, fluoxetine, aka Prozac, and citalopram or Celexa. Knowing these four are SSRIs for depression and anxiety is just fundamental. No way around it.
But it's not just about SSRIs. There are other major players in the antidepressant world. You've got duloxetine and venlafaxine, those are SNRIs, a slightly different mechanism. Then there's bupropion, or Wellbutrin, which is kind of in a class of its own, and get this, it's also used to help people quit smoking. And we can't forget trazodone. It's an antidepressant, but it's often used off-label in lower doses for insomnia because it can make you pretty drowsy.
Okay, stop and listen up because this is critical. We're now talking about Schedule IV controlled substances. That's alprazolam or Xanax, zolpidem or Ambien, and tramadol, which is Ultram. As a pharmacy tech, that C4 designation is a huge red flag. It means there are special, strict rules for everything. Handling, dispensing, counting, record keeping. This is a massive topic on the PTCE, so you absolutely have to know this.
And if you thought Schedule 4s were important, well, Schedule 2s are on a whole other level. C2s have the highest, strictest level of regulation you can get for an outpatient prescription. We're talking about powerful opioids like oxycodone and hydrocodone/APAP, and major ADHD stimulants like methylphenidate and dextroamphetamine, aka Adderall. When you see C2, just think maximum security, maximum scrutiny.
Okay. To wrap up the CNS section, we've got a few more common but very different drugs. There's gabapentin, which is technically an anticonvulsant, but you will almost always see it prescribed for nerve pain. Then you have cyclobenzaprine, brand name Flexeril, which is a super common muscle relaxant. And finally, hydroxyzine. It's an antihistamine, but it works so well for anxiety and itching that it's used for those all the time.
All right, Section 4. We've tackled the heart and the brain. Now let's move on to our final section. This is kind of a grab bag of key medications from other classes, but they are all so common and so important that you just can't miss them.
First up in this group, let's talk about the endocrine system. And these three are absolute giants in the pharmacy world. We have levothyroxine, or Synthroid. It's for an underactive thyroid, and it is consistently one of the most prescribed drugs in the entire country, period. Then you have metformin, which is the go-to first-choice pill for type 2 diabetes. And finally, insulin glargine, brand name Lantus. This is a long-acting insulin that is just essential for millions of people with both type 1 and type 2 diabetes.
Next, let's hit the gut and the lungs. For acid reflux and ulcers, you have omeprazole and pantoprazole. They're both what we call proton pump inhibitors, or PPIs. It's a cool name, right? They work by literally blocking these tiny little pumps in your stomach that produce acid. Then, for breathing, we have two key players. Albuterol is your rescue inhaler, the one you use for immediate relief when you can't breathe. But Montelukast or Singulair is a daily maintenance pill. You take it every day to prevent issues in the first place. Rescue versus maintenance. That's a huge concept to know. Okay, how about infections and inflammation? Here are two of the most common antibiotics you'll ever see: amoxicillin, which is in the penicillin family, and azithromycin, which is famous for being in the Z-Pack. Then we have two different steroids, and I want you to think of them like this. Prednisone is a powerful pill that works systemically, meaning it's like sending in a firefighter to put out inflammation all over your whole body. But fluticasone is used locally. You either inhale it for asthma, that's Flovent, or you use it as a nasal spray for allergies, which is Flonase. It targets one specific area instead of the whole system.
And to wrap up our list of 50 must-knows, we've got these last four. Meloxicam and ibuprofen are both NSAIDs, that's non-steroidal anti-inflammatory drugs, for pain and inflammation. You know ibuprofen as Motrin or Advil. Then there's allopurinol. This is the main drug used to prevent those incredibly painful gout attacks. And lastly, tamsulosin, or Flomax. This one is for something totally different. It's for BPH, which is an enlarged prostate, and it helps improve urinary flow and MET.
And that is it. You did it. You just made it through the 50 most critical, highest yield drugs for the PTCE. Seriously, take a second and let that sink in. You just built a massive piece of your foundation. By tackling this with a smart strategy, you're not just memorizing, you're understanding, and you're focusing your efforts exactly where they need to be. This is how you study smarter, and this is how you're going to pass that exam.
Amazing work today. Seriously. If this breakdown helped you, please don't let the momentum stop here. Your next step is to jump into tiers 2, 3, and 4. I've put the links right in the description for you. And before you click away, if you could do me a huge favor and hit that like button. It really helps other future techs find this. And of course, subscribe so you don't miss the rest of the series. Oh, and drop a comment and let me know if you'd want some flashcards or quizzes to go with this. You are absolutely on the fast track to crushing this exam. Keep up the great work. Your PTCS success story is just getting started.